title of our webinar today is the ACA, or what is known as the Affordable Care Act, and it being a golden opportunity. We're going to talk a little bit about that throughout today's webinar. Again, let me introduce myself, and let me see if I can get this picture thrown up here for you. First of all, before I get that going, I wanted to make sure that everybody understands that everybody can hear me. And you'll see up in your right-hand corner of your GoToWebinar control panel, there's a little graphic of a hand there. And if you don't mind clicking on that hand, that will indicate back to me that you're hearing me. Hopefully you're seeing me okay. And I see some coming up here. Brad, good to have you this afternoon. Chris, and then there's Christopher. Good to have you and see you there. Good to have you. Glenn, Greta, we've got Michael, we've got Liz, Richard, Sung, Serinda, Tanya. So we've got a good group of folks coming in, and we still have more coming in, and we'll still have some more people coming in. But thank you for letting me know that my voice is coming through loud and clear. Again, my name's Eric Auger. I'm the Director of Research and Development here at American Business Systems. A lot of what I do is some of the things, the articles that we're going to be talking about today during the webinar, and then also a lot of things to do with medical billing and actually how you get clients. So that's some of the things that I do. But first of all, let's talk about how to get to know American Business Systems. Well, first of all, I want you to know that some of you may have contacted us through many of the different types of franchise organizations out there. And we just received this top franchise plaque from Franchise Direct 2013. We are among one of their top franchises or business opportunities with them. So we wanted to show you our new plaque, one of our newest plaques that we have gotten. But let's get to American Business Systems. If you haven't yet been out to our website, it's absystems.com. And you're going to want to go out there and spend as much time as you need to on our website. But you'll notice there on two big orange buttons, one up here at the right top and then one here at kind of the lower right-hand corner. If you'll click on that, there'll be a little information we're going to ask you about, and that will get you into what's called our virtual brochure. Now, in our virtual brochure, it is much more depth in information about each of the opportunities, how we help you get clients. That's the one that you're seeing right now. And then through there, you'll be able to peruse this information on your own, hear videos, hear testimonials, even have an opportunity to talk to other licensees. So you might want to take down those numbers as you go through that, but spend as much time as you need to in that virtual brochure. For those that would like to come by and visit with us, here is our address, 5751 Kroger Drive. It's in a community called Keller. We're just north of Fort Worth. So please come on down, come by and visit us. If you want to contact us, our number is 866-565-8143, I believe it is. Anyway, we're going to put that number up there for you in just a moment so that you can also come on by and just visit with us. Another way to get to know us is through absystems.com/blog. Here you'll be able to find testimonials of people that have come through training, personal testimonials and interviews that Patrick Phillips has done with some of our licensees, but also you'll find out and see other webinars that we've done. Now, folks, we've done several hundred webinars that are posted out there, so please go out there and see past webinars if you'd like to. Now, if you want to keep up with us on any new things that do hit the blog, you might want to follow us on Twitter, and that's @absystems. So for you Twitter users, and you want to keep up with us, what's going on a daily basis, basically, we're always posting something up there about medical billing. You can certainly follow us there at our Twitter account. Now, our last workshop of the year is December 9th through the 13th, and that is just right around the corner. I believe it's about two and a half weeks away. And so you're going to want to just go ahead and get on started with us. We've got a few seats left. We're about halfway filled this class up. There's a lot of people that will start signing up right directly after Thanksgiving. We see that happen quite often. So you're going to want to go ahead and just jump on board with us and get that going as well. And we'll talk a little bit more about those dates here towards the end of the webinar as well. I want to introduce to you our CEO and founder, Mr. Patrick Phillips. Patrick has been as an author. He's actually on the editorial board of Billing and Coding Advantage magazine. Folks, if you're not familiar with this magazine, this is a national magazine that goes out to several hundreds, if not thousands, of medical billing companies already that subscribe to this magazine. Now, this is not just an online magazine. This is actually a full print magazine. And if you'd like to see this particular article, get with us. Send your ABS business coach that you've been dealing with just a quick little email saying, hey, I'd like to see this article. Patrick wrote this back in, I believe, the August-September issue of this year, The Bright Future of Medical Billing Companies. So be sure to ask us for an electronic copy of that, and we'll certainly send that to you as well. He is also an author, and he's written these 2 books. He's also co-authored several other books, but these 2 I really want to just draw your attention to. The one on your left is How to Reprogram Yourself for Success. This is to get all that negative, bad thoughts out of your head and really start thinking more positively. Not really from a psychological standpoint, but really we always have our self-talk, and this is a book that will really help you think a little bit differently about your success. And then the one on the right, he did co-author with a CPA called Cash Crunch to Cash Flow. You will find this to be very helpful for you as a licensee of American Business Systems, because this is part of your marketing of what we do. Matter of fact, this is sort of what you would consider to be your Bible of medical billing, because a lot of the solutions that are in there, or should I say every solution that we have in there, is some of the solutions that we have here at American Business Systems. So, but listen, without further ado, Patrick, why don't you go ahead and join us and pop on your video camera there. It's good to have you this afternoon.
Thank you, Eric. Great introduction there. And for those of you who've not been on our webinars, like Eric said, he's the Director of Research and Development. Eric is actually behind the scenes doing a lot of the research that you'll see today in today's webinar. And Eric, you've done a terrific job. I didn't realize there was that much out there on the internet right now that's really positive towards our business and people who are getting into medical billing with the Affordable Care Act. So good job.
Yeah, absolutely. I tell you, I know that I get the questions, and the rest of the team, we're always getting questions about the Affordable Care Act. Is this still a good business to be a part of in the medical billing business? And so, although we have answered these questions in the past, Patrick, I think it's going to be good for us to kind of go through them and even see some of the new articles that have just been recently written in the last couple of weeks here.
And like you said here, Eric, this is a great title for this webinar because this is a golden business opportunity for people who are looking at getting into any business. And let's face it, today, it's probably wise, even if you have a good solid job or what you think is a good solid job, it's probably wise to have something that you're working on, at least on the side, to try to get going in case, you know, that day comes when they call you into that little room and hand you that little pink slip.
You've had a little experience. I think we've all had experience of getting that little pink slip or that little visit. Hey, come talk to me in this other room, and oh, by the way, pick up your keys and everything else that you belong.
Yeah, you've heard this story before. I tell this usually at our live training workshops that we hold here. But yeah, I was working for Apple Computer back in the mid '80s, and they did that. We had a plant out here in North Dallas, Apple did, and they were shutting that down, moving everything back to California. But I didn't realize that. So they called me into the little room one day and say, "Hey, guess what? Here's a computer, and here's all your stuff, and it's been nice having you." It was devastating. If that's never happened to you, you don't want that to happen.
That is. And, you know, and Patrick, we know that folks that whatever age they may be, whether they're a young corporate person just getting started in their career, or, you know, if they start reaching the ages that you and I are, you know, if they get laid off their job, it's kind of like, what can they do? And we'll find out that a lot of folks, instead of just having to re-engineer themselves, they just take their same skills and apply it to this particular business and into these things here. And I believe we're going to see here as we move forward in the next coming months and this next year that there are a lot of opportunities that, as we know, the Affordable Care Act has kind of hit some snags along the way, and that does present opportunities. And I'm telling you, as well as you know already, doctors are needing help tremendously. And
Yes.
the Affordable Care Act, in and of itself, has been a very difficult thing for people to kind of navigate through. So just imagine if you, as someone that's looking to get in this business, is having questions. Can you imagine what the doctors are going through? So
Yeah, you and I have kind of talked about this, Eric, that this is almost like a tsunami of all these different things in healthcare happening at one time. And I think we're going to talk about that partially through the webinar today. The ICD-10 codes that are coming next year. You've got the electronic medical records that doctors are being forced to get into, and all the changes. Doctors are having a hard time keeping up with that. And so, again, it's a perfect opportunity for our licensees to get involved and help those doctors with spending the time on, seeing more patients.
Well, listen, before we go to this next slide, I want to let everybody know that there are, you may have questions, and feel free to ask Patrick and I questions as we go through the webinar today. You'll notice up in there's a little question mark of an icon again that you can click on and then type in your questions. Those questions will start to come into us. And with that, William's got a question here, Patrick. And before we actually get started on this next slide here, the question that William's asking is, how saturated is the market already with medical billing companies? That's a great question to kind of get started with.
It is, and we get that a lot because people have been hearing about people doing medical billing working out of their home for years. I mean, my wife started doing medical billing here in the Fort Worth area back in 1987. So that is, 25 years ago. But the weird thing is that it seems like the more people that get involved in it, the more need there is out there. Now, here's what I mean by that. Doctors, at first, back when we were starting, they had to be educated. They didn't really understand the advantages of outsourcing this billing, to someone outside their office because, let's face it, doctors are kind of control freaks, right? They like to keep it in-house. They like to do it with their own staff, their own software. They like to have the data right there, on their own computer. And we have found that that's just not the case nowadays. Doctors are being educated, and so our licensees find it easier and easier to show those doctors the advantages of outsourcing because they don't have to educate them as much. As far as saturation, I think one of the best ways to show that, Eric, is for people to go to our website. There's a little link up there under, I think it's how much is the investment or something to that effect. How much can I make? I think that's the tab at the top of our website.
Correct.
And there's a little tool there where they can actually put in their zip code and find out how many medical providers there are in your area. Let me give you an example. Right here in the Dallas-Fort Worth area, there's like 36,000 medical providers. And we have a handful of licensees, of course, here in the Dallas-Fort Worth area, but none of them, Eric, none of them ever come to us, do they? And ever say, oh, I ran into another ABS licensee or even another medical biller. It's just like the market seems to be wide open out there because most people don't know how to market the way we teach people to market. And so other medical billers that are out there are just not an issue at all.
That's correct.
So anyway.
Well, let's kind of talk about the opportunity. Let's first talk about the opportunity that doctors are still see, and why you're going maybe to this. Let's see if I can get to this next slide for us. Even with that, Daryl asked the question, or it basically states that his fear is how many doctors are going to leave their practice, their private practice, to go work for hospitals because of the government restrictions and lower pay in their private field. Well, I mean, we couldn't have segued in a better question than going to our next slide here. And let's kind of talk about this, Patrick, because I want you not to only address, what we're seeing here, despite Obamacare impact, more want to become doctors. And as people can see, that was written, the 13th. I think that's like today.
Yeah.
So, and this is from Forbes. This is not from American Business Systems. This is not from anywhere else. So, Patrick, let's do this. You and I in the past, we've talked about doctors leaving their practice, that there may be a shortage of doctors. How is all of this working now with even young people still want to become doctors, and how this is actually a positive thing with everything that's going on with the Affordable Care Act?
Yeah, I thought I would just turn off the slide there just for a second so we can kind of focus and talk about this, Eric, because it is important that people realize that doctors, in some cases, older doctors especially, they don't want to put up with all this change, right? So some of them are retiring. And so there are doctors, of course, who are going to be moving out of the system. But at the same time, as this article says, there are many, many young people who want to get into the healthcare field. Why? Because it's a very satisfying field. But believe me, they don't want to get into this because they want to deal with insurance companies or government agencies and all the billing that's involved in claims. They want to deal with patients and help patients. And that's what our licensees help them do, is free up their time so they can focus on their core competency.
Yeah, and I think, again, there's a lot of myths that are going on out there. And I know we've talked about the doctor myths of all these different things. And Daryl's got a valid point about the doctors leaving their private practice, wanting to go to hospitals. But and I can't remember which webinar that we did. Daryl, we did one here just recently where there was an article that was actually a myth, that the doctors are saying, hey, look, there are not as many doctors going to hospitals just because they can't get a hold of their billing. Matter of fact, there are many more doctors that are leaving the hospitals to go back into private practice. Patrick, you know that we're currently, with our research and development, we're working with a doctor just down the road from us who is doing that very thing. This is in Keller, Texas, within a half a mile of our office, a doctor leaving the hospital to start a private practice.
Yeah, it happens all the time. Doctors have gone into hospital situations and groups, but we're hearing from our licensees of those doctors being very unhappy with that situation because basically they become employees. They're told exactly when to come to work and when to go home and how many patients they can see, have to see per day, and of course they're limited in their income as well. So they're not as happy doing that as they are when they're in private practice. The sad thing is, Eric, is we found out, you and I, about a few weeks ago, the doctors actually lose their patients when the doctors give up all that to the hospital. Those patients become the hospital's patients.
Yeah. So Daryl, here's how we want to answer your question. Are there doctors leaving their private practice going to the hospital? Yes. But also understand there is just as many doctors leaving the hospitals, getting back into private practice. And then with that, they're having to rebuild their private practice from scratch because, as Patrick said, they've actually signed those lives, those patients, over to the hospital, and they're finding out that they're not making it any better than what they were making it when they were in private practice. So this is, again, like the title we have today, this is a golden opportunity for those that are looking to get in the medical billing business. It's a great opportunity for you to get into it.
Yeah, so the fact that there are more and more young people wanting to become doctors is a good thing, of course, because, well, there'll be, what is the number? I keep hearing different numbers, but 40 million uninsured Americans that will be moving into the system and have to be taken care of. We're going to need some more doctors for sure.
Yeah, so there are going to be an increase of doctors. There will be doctors that are leaving the private practice because they're retiring. They don't want to mess with this anymore. But there are just as many doctors that are coming in behind them. And even though that they've heard all the bad things about EMRs, which is electronic medical records, or billing platforms or whatever else, these new doctors are coming in. Remember, they're the X generation, the Y generation that would play video games anyway. So they're going to be more apt to doing a lot of the things that we're doing right now.
Exactly.
So, folks, the doctors are seeing the opportunity. Even for them, there's a great, great opportunity. Now, let's kind of talk about us, Patrick. We're entrepreneurs, and let's see what some of the other entrepreneurs out there in the world are talking about. Now, this is from entrepreneur.com. So this is an article. Again, this was just last month, October 1st. And look at the title of this, Patrick. Despite cons, entrepreneurs see opportunity in Obamacare. Let's kind of talk about this. And Rebecca Iliff, I think that's how you say, her last quotes are this: "It seems clear to me that no matter what side of the Obamacare argument you're on, one thing is certain: opportunities for innovations abound. How do you think entrepreneurs will be part of this evolution?" That's a question I'm going to ask you.
Yeah. Well, here's the way I look at it. People who are looking into getting into any kind of business. I mean, I know this is not for everybody, but those people who've decided through their research that this is a good opportunity, what better opportunity could there be? Healthcare is 1/6 of the economy, soon to become 1/5 of our entire economy. So think about it. If you're looking to get into any business, you want something that's on the growth. I would hate to be a car dealer right now, for example, wouldn't you, Eric? Or in the real estate business, even. This is the hottest thing that's out there. And as long as there are people, as long as people get sick, as long as there's doctors and insurance and claims, there will always be a need for people to actually do the billing. Somebody has to bill either the insurance companies or the government.
Well, and I'm going to interject. This question has not come in, but let me interject this question here, Patrick, because of what you just said. A lot of people are in fear that, especially with getting into medical billing, about this single payer. And I know we don't have a slide up here on that for the single payer, but you ran across one of the gentlemen from, I believe is it from
HBMA.
HBMA. Why don't you tell everybody about what you heard from him on this whole single payer deal?
Yeah, folks, you can go out to hbma.org. That's the Healthcare Billing and Management Association. This is the organization that has a presence and a voice in Washington. And we're a part of that organization. Some of the people that are in the staff of that organization went to Washington recently and met with the people that are directly tied in with the whole Affordable Care Act. And as they met with some of these chief executives, they found out that those people said directly to them, there is no way that our system that we have right now is going to go away anytime soon. There will be always somebody that has to do the billing. And as you know, Eric, back in 1965, when Medicare was introduced, that is a form of national health care, at least for people over the age of 65, right? And if the government had wanted to get into the billing side of medicine, they would have done that back in 1965, and they didn't. And they won't ever want to be on that side of the whole thing. Even if it all turned out that everything had to be billed directly to Medicare or Medicaid, somebody has to do the billing for the doctors to get paid. And so there'll always be a need for either the doctor themselves and their own staff doing it, or they'll figure out that it's cheaper, better, easier, less stress to just outsource it to somebody who does it.
Well, I think we can probably, the best that we can, kind of, if they wanted to do something like this anyway, we could even say the government collects taxes from us anyway, through our whatever we do through our why are they not collecting why are they not doing our income tax, but we have to go get a CPA to go do it? You see what I'm saying?
Right.
It's the same principle. If the government wanted to really be involved in those types of things, they would have already taken care of that. And that's just a good example. Listen, folks, going to a single payer and then plus the government having to do the billing, that's not going to happen. I think we're going to see tremendous amounts and still tremendous opportunities for medical billing companies, because let's also interject this too, Patrick, that as becoming an ABS licensee, you're more than just a medical billing company. You're a revenue cycle specialist. And again, we'll kind of explain a little bit more about that, but if you want to know more about that, we have other webinars that you can certainly go down and download and listen to. But there's where the separation becomes. We're not just medical billing. As we'll even show you today, we're providing you the opportunity for doctors to have an electronic medical record system, and we have to say we feel like we've got one of the best ones in the marketplace right now. All right, let's get going. Let's keep going here. Entrepreneurs, we see that this one said entrepreneurs see the opportunity. What about entrepreneurs seizing the opportunity? Whenever I was doing my research on this, I immediately thought of you, because you always refer to yourself as a serial entrepreneur. And this guy, Martin Willoughby, who is an author of Zoom Entrepreneur, I mean, Patrick, we couldn't have said this any better. He says this: regardless of what happens with Obamacare, I hope that you will seize on this opportunity to expand your thinking, to embrace the changes in the profession, and find creative ways to seize the opportunity that come along with change.
You
What do
know,
you think about that, Patrick?
well, I believe that that has the same thing basically that we've heard many, many times in the past. The way to get rich is to find a need and fill it. So as far as timing and a so-called window of opportunity, folks, I can't think of anything better timing-wise than the Affordable Care Act. Obamacare is the reason why you should be getting into this business right now. Not worry that it's going to do something to change the industry. Again, we couldn't say this better, folks. Go to the website. You see it right there on the screen, martinwilloughby.com, and find out for yourself. This is the perfect time to take something that's got a major change in it and jump in and make a lot of money.
Exactly. And Patrick, let's move on here, because in previous webinars, you've talked about disruptions in the market, just disruptions. So I'm going to let you kind of go through your 3 bullet points here and describe and explain what you mean by disruptions in the marketplace.
Well, anytime that something new comes along, something that's a big change in what's going on, there's always a disruption. And disruption, of course, means that there is going to be change. So let's take the economy, for example. A lot of people right now look at the economy and go, okay, it looks like there's some kind of depression, recession going on. We've got all this unemployment. And so that worries people. Actually, what happens is in that disruption, there can be change. And when things change, that means there are opportunities. So Obamacare is a perfect example of that. And of course, good serial entrepreneurs like myself seize on those opportunities. That's what makes them entrepreneurs. Now, let me give you an example of that, Eric. Back in 1987, when my wife was doing the medical billing for doctors here locally, I was a computer consultant traveling around the country. And this was a huge, huge change from doctors moving from paper insurance claims, filing on paper, to switching over to electronic. Well, my wife and I got excited about it, and we got involved in one of the first online systems that would let us submit the claims electronically. So she moved from using a typewriter and mailing all the claims to filing them electronically. That was a huge disruption. You see, a huge change that made it a great opportunity for us to get out there and tell the doctors that, look, you've got to start doing this electronically. This is the move. The government's pushing you this direction. And we honestly thought about it and talked about it, Eric, that maybe within 2 or 3 years, we wouldn't even have any business because all the doctors would figure out how to do it themselves. Little did we realize that that was a major change for doctors. And they don't like to change. They wanted to stay the same. And so instead of trying to switch and figure out the software and how to hook up, and back then we had to dial up through modems and connect with all the different clearinghouses and insurance companies, they just said, here, if you're willing to do our billing for a small percentage, take it, do it.
Right.
And that's how we built our business.
It is these changes that come along, and even in the past we've done webinars where you've talked about things like Procter and Gamble. They became out of a recession or a depression, and then they started up. And Microsoft, the same way.
A lot of big companies, yes.
A lot of big companies have do this. And matter of fact, whenever I was doing my research on all of this, Patrick, I ran across an article that actually was from last year, and it talked about the Obamacare billionaires that were going to be coming out of this. And so there are a lot of people that are going to make a ton of money. And it had to focus in on, guess what? The IT side and the billing side of everything. There's where the money's going to be made. But it's interesting that we talked about disruption, and then I came across this company or this institute, Clayton Christensen's Institute for Disruptive Innovation. Folks, this is an actual website that you can go to and look at some of the quotes here that we found on here. I think I'm kind of paused here, so I can't get to the next slide.
Here it comes.
There we go. It says, seize the ACA, the Affordable Care Act, the Innovator's Guide to the Affordable Care Act. And they started off on this particular blog. It says, throughout history, disruptive innovations have repeatedly and often predictably transformed entire industries through the introductions of affordable and accessible products and services. That's what we're in. That's
Exactly.
exactly what we're in. Now, what I found interesting, Patrick, a lot of these blogs have responses to blogs. Listen to what one of these guys says on the response of this. This is in response to their blog post. This guy writes, "It's absolutely indisputable that Obamacare has introduced a level of change and chaos that will have lots of winners and losers. Speaking for myself only, I think this has helped entrepreneurs. When things were in status, there was little motivation for providers to work with startups."
Wow.
Unbelievable.
You would
And
think
again,
that,
look when this post is, September 2013.
yeah, you would think that that's something that I wrote on my post, on my blog, because it goes right down the line with what you and I have been saying for the past few months. Well, ever since 2010, when the Obamacare thing was moving into place, we said that exact same thing, that this change, this chaos will have lots of winners. We're going to be amongst the winners, and that's why we've been around for 20 years. And our licensees
Well,
are winning, of course, with us.
I would say let's talk about a few of those winners there, because we talked about the doctors seeing the opportunity. We see entrepreneurs seizing on the opportunity.
Oh,
Here are a
Tyranny
few of our
martens. Yeah.
licensees. Talk about Tyranny martens. She was just a housewife just a few years back.
Yeah, it's just amazing. Her husband wanted her to be able to do something to where she didn't have to work outside the home. They had 2 children. And so she did some research, found us, researched us, found the Better Business Bureau here in Fort Worth, said we had an A+ rating, and said, look, you guys, I'm going to make sure that you guys are for real. I want to go visit one of your licensees. Now, this is rarely that this happens, but folks, if for some reason you want to go visit a licensee, we've got people who will let you come to their, I mean, they've actually opened an office somewhere. Now, this lady that she visited, though, she's in California, Tyranny is. The lady she visited was in Arizona. And so it
Right.
was just kind of a short drive. She went out there and spent a couple of days with this lady and visited with her in her home. She was gracious enough, one of our licensees, to open up her home. Her name is Marilyn. And it was so impressive to Tyranny. She went back and told her husband about it and was all excited. She said she has this beautiful two-story home she just built. She's got several bedrooms set aside as offices and people coming and working in those. And there was lots of stuff going on. And her husband, he had a background in the security industry. And he said, I'll bet if I researched that, they just hired some people to come in that day and brought in some, computers and made it look like it was a real business. And Tyranny said, no, honey, you would have had to be there to believe it. Well, the long story short is that I went out and visited Tyranny. I took this picture myself in front of her commercial office building. You can see her company name there on the window. And she started with us in September of 2008. When I visited with her, Eric, she only had 5 doctors. And now she has over 50. So that was only about 3 years ago when I visited her. So she's pretty excited. She seized the opportunity. She took it and just ran with it. And so I'm very proud of Tyranny. She's come down and done some instructing for us. She's been one of our instructors at some of our classes in the past.
And she's one of the licensees that will take a call from anybody that's on the call or might be listening to us later on, and she'll tell you that the Affordable Care Act has actually helped her business increase. She says she's thinking that's one of the biggest components, the tipping points of her particular business is this whole Affordable Care Act.
Yeah, Eric, you're right. I mean, she's actually told people on webinars that it was because of Obamacare coming down the pike that she got in the door, that doctors wanted to talk to her because there were so many changes coming about with electronic medical records and the ICD-10 codes that are coming next year, that they were worried about it, how to keep up with all this change. And so when she would approach them, they opened their doors wide and said, come on in, we're ready to talk. And they hadn't done that as much in the past. We're hearing that from a lot of our licensees out there.
Exactly. All right, and then the other one is Benny Bjordy. Benny was just with us here just shortly, and I think he's one of the ones that we've had around, probably one of the longest, is Benny and his family. And I know that he's been around since 2005. A lot of people ask, is this one of longevity? Is this a business of longevity? Well, I'd say going on close to 10 years here is pretty doggone good for someone like Benny. And he's in New York, so he was just down here. You just got through visiting with him too. Talk a little bit
Yep.
about Benny.
Yeah, he came to our training workshop. What was it, Eric? Three trainings ago, maybe sometime in the summer,
I
I
believe
think,
so.
because he wanted to see what all we had added. I mean, you can imagine that was 8 years ago that he had been through our training, and we've added all some of the services we didn't have back then that we have now. That are in our portfolio of services for licensees to offer. And so he wanted to come down for himself. We had also changed some technology partners, and he wanted to see some new platforms that we had introduced for our billing, and he was blown away. Eric, this guy is an amazing guy because he had a janitorial service when he met us, and he'll tell you he never made a dime. He lost money with that business and worked at it for 2 years. And he said, when I ran across you guys, I thought this sounds too good to be true, you know? And so, but he got involved with us, and him and his wife, Patricia, came down to the training, went through it in September of 2005, and then went back and built this business. Now they have a full-time office. Those are 4 of his employees there. I think he's got 6 now.
Right.
I think he's got somewhere around 13, 14 practices that they do billing for. And they're loving it because they have 4 children. Benny used to be in the stock market, so he loves to trade online. So when I showed up, I actually took that picture too there in New York. I showed up and I visited with him, and when I walked in on his screen, he was trading there some stocks. So he says, Patrick, this has just allowed me to kind of semi-retire. I sit in here, manage the office. My wife helps out, and he says it's a wonderful business. So.
Well, let me ask you this before we go to the next slide. All those new services that you talked about that Benny didn't know about, what did that cost him to add to his portfolio?
Absolutely zero. When we add new services for our licensees, we always just roll them out to the licensees, give them the option as to whether or not they want to offer them, and then we give them free training. We give them marketing materials to go out and market them. And the reason for that, as you know, Eric, is because we have modeled our business so that we make a few pennies on each one of those transactions. So naturally, we want as many licensees out there marketing our services as possible because we make money when they make money. It's a win-win.
Well, it's amazing. William just sent a question in, and he says, do you see the services you're currently offering growing? And it was just, as that question was coming in and you were talking about other services, it was just a great segue to kind of talk about, what about other services as we bring these things on board. So thanks, William, for kind of helping us with that one. But yeah, all those services are always covered as long as you're an ABS licensee.
And we have some on the drawing board. As you know, Eric, you're helping to test some of those out, beta test some of them, because we don't always roll those out just instantly, guys. We give a lot of thought and testing to those. And this one that's coming up pretty soon, Eric, again, people can't ask questions about that because we can't reveal a thing about it until it's released to our licensee base. But I can just say this. There are people who are going to make 6-figure incomes from this one service alone that's about to roll out.
Correct. Yeah, absolutely. Yeah. Well, Patrick, we kind of talked about entrepreneurs seizing the opportunity, doctors still seeing the opportunity. Let me ask you the question here with this next slide. What is everybody seeing, Patrick? Just what is it? What is this opportunity? What are the things that they're seeing?
I think what people really see in this, Eric, is the ability to run a business that is able to run from anywhere, anytime. I mean, literally, with a laptop and a cell phone, you can run this business. And we've had licensees travel all over the world and actually continue to run the business because all they need is a laptop that has an internet connection. And they can log right into our system, see everything that their people are doing back home. Hopefully they've got some people working while they're on vacation. Or if they're traveling and want to manage their business like some of our instructors do when they come down here to teach our classes, they just go back to the room at night with their laptop and connect and can do everything that they could do there from their home because ours is a cloud-based system. So that means
Correct.
You get on the internet through any browser you want and just connect directly to it. People love that flexibility. They also lack the flexibility of not having a territory. Eric, as you know, we've got people that have licensees that have clients all over the United States. You're not limited to a certain geographic area because anywhere there's a doctor, that needs claims processing, you can do it. And if you've done a good job for a local doctor and he knows a doctor in another state, it doesn't matter because it's not based on paper. You don't have to transfer anything. It's all electronic. It's paperless. And so you can do everything over the internet and over a phone.
Well, and again, going back to that quick slide right there, those are some of the things that people are seeing. But even companies outside of American business systems, like the magazine that actually asked you to write articles, didn't you just recently, they asked you to do a webinar for them as well?
Yes, BC Advantage Magazine actually has some webinars that they post on their site for people who subscribe to their magazine. And some of them are, you have to pay for them, $30, $40 to attend each one of those webinars. They're usually about an hour long, just like ours are for our licensees, except the difference is we don't charge anything. Our licensees can attend as many of those webinars as they want. We have one this Friday that Cynthia Anderson is presenting, one of our licensees, and we have one just about every week now and have been for weeks now. So the difference is that people like BC Magazine are looking to us to bring them content because we are the ones that are staying on top of everything. I mean, being the nation's largest network of independent medical billing companies in the United States, we have a lot of information coming from our network to us about what's going on out there in the field. And they like that.
Well, one of the things that people are seeing and some of the feedback that we've gotten here is what we see basically on this next slide here, Patrick, and that is that doctors are they feel like they're having to do more with less. Now, I call this a golden opportunity. This was something that you and I kind of ran across just a few weeks ago. This was actually an interview that was done on Fox News. Now, whether you subscribe to Fox News or not, it doesn't matter. These are what these doctors are talking about here, and they are just flat out saying because of what's going on with the reimbursements that they are having to do more with less. Reimbursements are falling, so we're having to cut staff. I don't know about you, Patrick, but that sounds like a golden opportunity to me.
Yeah, I mean, think about it, folks. When you have doctors saying stuff like this, isn't that an invitation to come in and say, look, you don't have to cut your staff. You can keep the same staff that you have now, just redirect them so that they're helping you see more patients so that we can handle all of the administrative and billing side of your business. They hate that part of the business anyway. They would rather turn it over to somebody else. This is a perfect opportunity for doctors to say, you know what, I now realize that I don't have to do with less. I can do with more by just outsourcing. Think of all the things doctors outsource now.
Exactly.
Everything from their legal matters to their accounting, their bookkeeping, all of that's outsourced. Why shouldn't the billing be outsourced as well? And it is in many cases.
And iClaim provides that to give them the opportunity to do more with less. Let's talk about iClaim, and we kind of talked about earlier about being a revenue cycle management company. Let's talk real quickly about what iClaim is and how this is presenting even to the doctors this type of golden opportunity here.
Yeah, when we talk about a complete revenue cycle management system, what we're talking about, folks, is not just doing the insurance claims billing. iClaim, which is our branded version of our cloud-based billing system, actually allows you to handle everything that there is to handle for a doctor as far as his revenue cycle. Now, the revenue cycle simply means every part of the doctor's business, from the insurance to the government agencies to the patients. How does that revenue get into the doctor's pocket? And how do we maximize that revenue for the doctors? Well, a good cloud-based system that works in real time, like iClaim does, can help the doctor get that money in faster. With you, of course, doing the work behind the scenes, using our system to get that money in their bank account faster, more of it, and like I said, much quicker than they do now.
Absolutely. And another thing is with the iClaim system, let's kind of show a few of the things that it can do, Patrick, and then we'll kind of keep moving on. And that is, it's going to allow them to pull reports. They can literally see all of everything that they've got going with their practice. This is why it's called a practice management system. Again, they can pull reports on the fly. You can see there on the left or the right-hand side of the screen It can be in different types of formats, whether it's the iPad or whether it's in another type of tablet or the iPhone or even Android phone. And again, with this system, not only can they have accessibility to those reports and find out what's going on with their patients, but here it is, because it's a web-based system, it eliminates them of can continue to do more with less, but it eliminates these IT people that you have to have, server-based type things. Again, this gives them the opportunity to view their schedules anytime, anywhere. And again, these are the things that these doctors are looking for. The e-prescribing that can be done through iClaim. Again, this is providing a great opportunity for you to provide these doctors, again, having them help them to do more with less, because we want to move some of those folks. A lot of people ask, are those people going to get fired? No, as Patrick said, it's get reallocated to other parts of the business so that they can see more patients and not have to be bogged down with a lot of the administrative stuff. So that's one of the benefits of having iClaim and being part of AVS here.
Yeah, we call it the cutting edge technology that's out there, folks, because remember, our revenue comes from the processing of the claims, and that means getting the money for the doctor faster, and using things like e-prescriptions and the latest technology that's out there that helps the doctor run his practice more efficiently. So when we say that we are helping the doctor do more with less, it's because they don't have to spend money on servers, IT people in their office to make sure everything works correctly. They don't have to worry about updates to software or updates to the coding or adding new user fees every time they add somebody on the system. This is all done for them by you. And so you're providing them with more technology and more things like e-prescriptions for less, because it's much more cost efficient for doctors to do this outside their office than for them to try to manage it inside. I think you have a chart somewhere down the line that shows that even.
I do. So let's kind of move on some of the other things that these doctors and our licensees are seeing. And one that's right around the corner is this thing called these ICD-10s, of this implementation. And Patrick, I showed this to you just yesterday. I came across this. This is the implementation cost. Now, understand, folks, this is what the doctors, this is what the so-called brainiacs in the coding world are telling these doctors, hey, get ready. This is how much it's going to cost you to implement the ICD-10 codes. And so what we're going to do here, I'm going to expand this up just a little bit to this next slide here, Patrick. Let's see if we can get to this next slide just real quickly. And boom, we should have, there we go. So now these are the potential costs that doctors are being told. Look at what it's going to cost them to start implementing these ICD-10 codes for a typical small practice. And this is, I think, out of 2 doctors with 3 staff members. $83,000 of implementation.
Unbelievable. Now
look at the cash flow disruption. Just almost 20 grand right there.
Yeah. And that's just for a small practice. You get to a typical medium practice with 5 providers, and now you're talking about over $250,000. Folks, now that can put a real dent in the profit, the annual profits for a medical practice. In fact, that's why some doctors have gone out of practice completely, gone bankrupt, because they have these kinds of costs that hit them all at one time. Now, these new codes that the government is forcing on the doctors will take the current code, which is in the thousands, I forget how many, maybe 10,000, to something like 100,000 codes.
Right.
So it's going to make it much more difficult for the doctors to run their practice and do their coding and keep up with all this stuff. And it's going to cost them money on top of all that. So that's the kind of thing that you can help with, because iClaim, happily, has all those codes built into it. And as Eric is showing here on this slide, we can actually show them that all those codes are built into it.
Exactly.
Excuse me.
Next slide here, and you can see all the diagnosis codes can be searched by number or keywords. And our system, our EMRX system, our iClaim system, it's already ICD-10 ready. And so what does this mean to you? This gives you another golden opportunity to walk into any doctor's office who are fearing, because again, what we just showed you is what they're receiving. They're saying, oh my gosh, it's going to cost me $85,000. Man, we're a practice of 5 doctors. It's going to cost us over $250,000 just to implement these ICD-10 codes. The cost for this for our licensees and for their doctors is all included in what the doctors are already paying. We give training, like Patrick said, we're giving training to our licensees on how to implement the ICD-10s, how to get the doctors ready for that. If they're using the EMRX, the electronic medical records platform, which we've done in the past, we've shown this, the system actually tells the doctors which codes they need to use, so they don't have to go learn all these new codes, nor have to implement them into their system. It's all part of what we're including in this. So, Pat, again, I can't think of a better opportunity for those that are looking to get into this business and licensees that are already in this business to gain more clients.
Yes, and talking about all these codes and everything that's stored in our system brings up a great question here from William. He says, how many redundant servers are you using to house the data and reduce the possibility of lost data? And if you have an intrusion, who's liable? Well, first of all, the data, of course, doesn't reside on your computer, William, as an ABS licensee, as a medical biller for us. It doesn't reside on the doctors. And yet any intrusion, of course, would be on a part of the technology partners that ABS is partnered with. Now, in over 10 years of using our cloud-based system, we haven't had any intrusion. In fact, we haven't had any downtime to speak of. The only time we bring it down is when we tell you that between 3 and 3:30 a.m. some Sunday morning, we're going to shut the system down for upgrades and that type of thing. There are no, because we do have 3 redundant servers that are out there in different parts of the country and, in fact, in different electrical grids, so that if one went down completely, the others just kick in and users would never even know that. So, again, your ABS rep can give you some more information about that, William. I thought that kind of fit in here, kind of. I don't know.
Yeah, absolutely. Well, listen, I know that we're getting close up to the top of the hour. One more little section here that I think that our licensees are seeing and other entrepreneurs are seeing is this thing where doctors are they're unsure of how they're going to get paid. Now, again, this is from Forbes magazine or Forbes.com, as we have down there, and this was entitled 40% of doctors' practices unsure about Obamacare exchanges. And if you look at that last little part down there, about the middle part of that section there, where it says, but more than 80% of doctors worried about what they will be paid from the plans participating on the exchanges. Folks, that's just a portion of what we know from doctors already. So if they're faced with this already, look at this other quote that we have here from another doctor who's worried about getting paid as well. And this doctor, I think I went one too many. Oh, let's go back. I'll let you.
Sorry, we were both pushing buttons there.
Yeah, and this is from U.S. News. This is from a few months back. But this Dr. Shirwantenko.
Don't even try.
I know it. Listen to what he says, Patrick. To get paid by the insurance companies, I have to pay about $20 in administrative fees just to collect it. Between the person that bills, the computer system, the ongoing support, about $20 per claim. So, again, here's another opportunity for our licensees.
And we know that for a claim that's an average, let's say, of $100, our licensees are going to charge anywhere from 5 to 8% of that. So the most they would be charging would be what, $8, right? And he's saying it's costing him internally, because of all the other costs he has, the hidden costs, about $20 a claim. They don't even make that on some claims.
Yeah, and so if you think about it, if we're talking about a $100 claim, that's 20%. Now, a lot of doctors want to get all bug-eyed whenever we say 6 or 7 or 8% that we'll do the billing for them. So, folks, how do we know that? Well, it's because of what we do here in this next slide here. When we actually do through our iClaim, this will actually help doctors ensure that they're going to get paid. How do we get to that is through our iClaim system, but that talks about our rejection rate, which means the when we process a claim, we have less than a 2% rejection rate. So that coupled with we're charging them actually less than what the doctors would say 20% there. Now we're at less than 2% of a rejection rate. So we're collecting nearly 98% of what the doctors are billing for. Now, on average, Patrick, we know that if the doctor's doing that in his own office, that average can be anywhere from 25 up to 30% of a rejection rate. So they're not collecting hardly anything.
Yeah, here's a good example. We have a little tool that we give to people that allows them to plug in the numbers that they get from the doctor or the office manager and actually show the doctor the bottom line here. Look, in this particular case, we've increased this doctor's revenue by 40%, $11,000 a month. That's $138,000 increased revenue because we took it from a 33% average rejection rate down to our 2%. That alone, folks, brings more money into the doctor's office just because of that one thing alone that our real-time cloud-based system does that is not normal out there for billing software to have that kind of low rejection rate. It's because we check all for errors before the claims are even submitted to the clearinghouse. And our clearinghouse is us. It's a part of our system. So we don't have to go through a third party and wait for that and get rejections. They're doing that because they don't want to pay the claims, right? The insurance companies don't want to pay them. But we have complete control over that now.
And that's exactly correct. And these are how we're winning. This is how our licensees are winning. So let's kind of turn the question back to our audience, Patrick. Let's ask them the question, what are you going to do to position yourself to seize this opportunity? William just answered. He says, I'm excited. Thanks for answering my questions. He's ready to, it sounds like, get on board and start getting moving here. But Patrick, what do they need to do to seize the opportunity right now?
Well, first of all, they need to do as much research as they feel like it's necessary to feel comfortable, not just with the industry itself, but with us as a company. I mean, you're basically getting into partnership with us. ABS has been around doing this for 20 years. It doesn't mean it's the right business, though, for everybody. So we want you to do plenty of research. One of the ways you can do that is to be on as many of these webinars as you wish. Before you become a licensee, after you become a licensee. Now, these are primarily for people that are looking into our opportunity, but we try to give enough information to make it worthwhile for anybody to attend. But do all the research you can possibly do, and then talk to your ABS rep and say, look, I believe what you guys are saying, but I want to hear from people who've actually made that decision, gone through your training, and now are experiencing what it's like to be out there actually building their business. And we'll put you in contact with licensees from coast to coast that can answer those questions, people like Tyranny and like Benny and others. Hey, I wanted to address one question from Ahmed. He says, when we were talking about Tyranny, remember she started in 2008, and we said she had 50 doctors. He thinks that's not a whole lot of doctors. He says, why does it take so long to bring in new doctors? For example, your licensee that started in 2008 has only 50 doctors. Now, the surprising thing for Ahmed would probably be to know that our average licensee probably only has a handful of doctors, maybe two handfuls, right, Eric?
Right.
A handful of doctors at $25,000, $35,000 a year, from each doctor could make you a good, nice six-figure income. 10 doctors could make you $250,000 a year. So when we say that a licensee has 50 doctors, the specific reason why Tyranny didn't is because, as I told you, when I visited her only 3 years ago, she only had 5. She's a mom. She doesn't like to work more than about 15 hours a week. She had other people doing most of the work for her, and yet she was still making a good income. When I went out there and put a fire under her, so to speak, she said, you know what, I could build this a lot bigger, couldn't I? So it's only been in the last 3 years that she's added another 45 doctors. I think that's a great goal for anybody to reach. We do have licensees, of course, who have 300 plus doctors. So they're out there. That was just one example.
Well, let's put up there that last little slide, because we are going through a little Q&A here, and we'll go through. Let's see. Here's a question that comes from Chris. He's asking, if you aren't a strong salesperson, do you need to hire a sales rep to recruit doctors?
Well, we certainly have licensees that have done that, haven't we, Eric? In fact,
Yes.
our licensee that's doing the instructing right now, in fact, it'll be here in December. Her name is Cynthia Anderson. She has used sales reps on a commission only basis to go out and build her business for her. They go out and do what she's taught them to do using our training materials to go out and actually present the opportunity. Usually there are salespeople who are selling to doctors anyway, maybe cotton balls or rubber gloves or equipment or something like that. And so they know. They walk into a doctor's office and see the chaos that's going on there and know that they need help. So they introduce the services. They sign up the doctor. They bring you the contract, and you pay them a part of the setup fee that you're charging the doctor to get started, and sometimes even a residual fee on the back end. So there's lots of sales reps out there that would love an opportunity to build up a six-figure income that's a residual that they really don't have to do anything for month after month.
Let's we're going to take one more question here. We're right up at the top of the hour,
Yeah.
Patrick. I mean, this was and then
Good
this will kind of lead us right into our training workshop. But Srini asked, looks like we need to have some prior exposure to medical terms and CARE Act terminology. Is this true? So let's kind of talk about our November class that's coming up, and those are the things that we talk about.
Well, the two licensees that we showed you are very typical of the people who come through our training. Tyranny had no background whatsoever in the medical field. Neither did Benny and his wife. And what would you say, Eric, when we asked that question in the training class? Out of 10 people, maybe one or maybe
Right.
raised their hand and said they've had any kind of background just in the medical field, not necessarily in medical billing. So, folks, it's a misconception of people that they have to know all these different terms, all these codes. Folks, we teach you everything you need to know to get this business started in 1 week. Now, that doesn't mean there's not ongoing training and learning to do behind the scenes, but you don't have to know the answer to every question. You don't have to know to every term. We cover all the basics you need in that 1 week to get started. And hey, listen, a lot of it's on the job training. Once you get that first client, yes, you'll continue to learn stuff, but you're making money.
Exactly, and you're making money with our support, with our help. We're here to help you. Patrick, as we kind of close out here, I know that you like to kind of end with the 100% money back guarantee. So why don't you go ahead and go through that, and then we'll put our slide back up for those dates there.
Well, yeah, I've got it here actually the way it reads exactly in our agreement with our licensees. Folks, when you sign up with us, we know it's a big commitment. We know it's a big step to invest this kind of money, a week of your time to come down here for training. And we've tried to figure out what's the best way to convince people that what we say is true. We know it sounds too good to be true. So the only way we knew to do that is to say, look, as part of your research and due diligence, why don't you just commit to coming to our training? Come through the training. You can sit through the whole thing for the whole week, get all of our handouts, all of our proprietary information about how we market, the profit potential of all the different services. And if at the end of the week, for any reason, it doesn't matter what the reason is, you don't feel like this is the right business for you and your family, just ask any of my staff members, and we'll give you a full refund, a full 100% refund of your licensing fee. Now, Eric, there is no other company. I can tell you this. I've been to a lot of webinars and seminars, and they may let you stay one day and say, if you don't like it, you can get your money back. No, we want you to see everything. And that's the only way you'll really know, right, if you see everything. But anytime during the week, you want to ask for your money back. We don't care. We don't want your license fee. What we want is your commitment to this business, folks, because, again, we make money when you make money. So we want you to stay in the business only if you feel like it's right for you, and that's the best way we know how to do that.